Welcome to Providence Anesthesiology Associates. As your physician anesthesiologist, we work with your obstetrician to manage your labor and delivery pain, with a primary focus on keeping you and your baby safe. Every woman's labor is unique, and every patient experiences labor differently. Although some women choose to cope with labor using only breathing and relaxation techniques, many choose to combine these with pain medication and an epidural. An epidural reduces pain during labor while allowing you to remain awake and participate in your delivery. Local anesthetics and other medications are used to block pain messages that travel from your uterus and birth canal through your spinal cord to your brain. The appropriate time to receive an epidural is unique to each person and depends on your labor progress, how your baby is responding, as well as your level of pain. Certain tests and lab work may need to be completed before we can administer your epidural. First, you must be admitted to the hospital, which requires both computer and paperwork. You will also need to receive an IV catheter and possibly receive some IV fluid prior to receiving an epidural. If you decide to have an epidural, maintaining a good position during the procedure is one of the most important things you can do to make the process easier. While sitting on the edge of the bed or lying on your side, you will be asked to curl out your back, almost as if you're trying to touch your nose to your belly button. We sometimes refer to an image of a scared cat or a boiled shrimp. This position will open up the spaces between the bones of your spine. Once you're in the proper position, your back will be cleaned with an antiseptic. The cleanser is room temperature, so this may feel cold. Next, with a very small needle, your physician anesthesiologist will numb an area of your skin in the lower part of your back where the epidural will be administered. Most patients experience a stinging or burning sensation as this numbing medication is administered, but this will only last for a few seconds. Once your skin is numb, you will next feel pressure as the epidural needle is inserted and advanced to the proper space. How quickly the anesthesiologist is able to do this will depend on your individual anatomy and how well you maintain the proper position. It is important to try and remain still while your epidural is administered. Concentrating on your breathing will help you remain still. Once the needle is in the proper place, a tiny plastic tube or epidural catheter will be inserted and the needle will be removed so that only the tiny plastic tube remains in your back. A brief tingling sensation may sometimes occur in the back or legs when the epidural is inserted. Once we confirm that the catheter is in the proper position, we will tape the catheter in a secure position so that it does not get pulled out during your labor. It is completely safe to lie on the catheter. There are no needles in your back and you cannot hurt the catheter or yourself. When you move in bed, please be mindful that you don't pull on the catheter so that you don't accidentally pull it out. Once your epidural is administered, you will not be allowed to get out of bed. Your legs will eventually start to become numb and may feel weak or heavy. An epidural can affect your ability to urinate, so you may need a catheter in your bladder once you're numb from the epidural. The entire process to place the epidural generally takes about 15 to 20 minutes. Once the epidural is in place, the first thing you will notice is that your contractions will seem shorter, and after about 10 to 20 minutes, the pain of contractions should be much less intense. As we strive to balance your comfort, safety, and ability to push, you should not expect a total lack of sensation. It is important to remember the epidural can help significantly minimize your discomfort, but it should not be expected to eliminate all feelings of pain and pressure. It is normal to feel pressure and the urge to push when the time comes. If you do not experience a significant decrease in your pain within 30 minutes of having the epidural placed, please let us know. You will continuously receive medication through the epidural for as long as you are in labor until you deliver your baby. If you start to experience an increase in your pain, you will have a button you can push that will automatically administer extra medication. Every epidural, every patient, and every labor is different. There are times when the epidural may not be providing adequate pain relief, and the nurse may call your anesthesiologist to make adjustments in order to try to make you more comfortable. You should let your nurse know if you start to have a new or different type of pain or the urge to push. In general, epidurals are extremely safe. As with any medical treatment, however, side effects or complications can occur. We will monitor you and your baby carefully and take precautions to prevent problems. Backache is common during pregnancy and often continues after your baby is born. There is evidence that epidurals do not cause long-term backache, although there may be slight local tenderness for a few days following an epidural. Although uncommon, it is possible for a headache to occur as a complication of an epidural. Holding still during needle placement decreases the likelihood of this complication. Occasionally, the epidural needle or catheter can enter an epidural vein. If this occurs, the epidural needle or catheter is repositioned to ensure that the medication is placed where it can provide effective pain relief. Life-threatening or serious complications, such as adverse reactions to medications, nerve damage, or bleeding or infection near the spinal cord, are extremely rare with epidurals. Please feel free to discuss any concerns with your physician anesthesiologist. After the epidural is administered, your blood pressure will be checked frequently for a period of time. Your vital signs and your level of comfort will continue to be monitored throughout your labor and medications adjusted as needed. Your baby's heartbeat will be monitored throughout your labor. Temporary changes in the fetal heart rate are common with labor and can occur with or without an epidural. Many mothers find they are able to rest more easily and even sleep during labor after the epidural is administered, allowing them to have more energy to push effectively when necessary. You do not need to make a decision about your pain management treatment plan prior to going into labor. However, we do encourage you to be informed of your options ahead of time, and please address any questions or concerns with your obstetrician or anesthesiologist. We are committed to providing you and your baby with exceptional care to achieve the shared goal of a safe and rewarding childbirth experience. Providence Anesthesiology Associates, an unwavering presence.